My name is Jennifer Temmel. I'm a thoracic oncologist at Mass General Hospital and an assistant professor of medicine at Harvard Medical School. Today we're going to be discussing our recent paper in the New England Journal of Medicine, which is a study examining the role of early palliative care for patients with newly diagnosed metastatic lung cancer. Palliative care is a medical specialty which focuses on symptom management and psychological support for patients and families who are facing serious illnesses like cancer. Sure. I think one of the main misconceptions about palliative care is that it's synonymous with hospice care. Palliative care is similar to hospice care in that it's multidimensional care, involves physicians, nurses, social workers, and chaplains, and the focus is to try to help people feel as well as they can. But the main difference between palliative care and hospice care is that palliative care can care for patients regardless of their prognosis or their illness, whereas hospice requires people to have a prognosis of 6 months or less. The goal of this study was to improve the experience for patients who were recently diagnosed with metastatic lung cancer. The reason for studying this patient population is they have a short life expectancy of less than a year and a high symptom burden beginning at the time of diagnosis that persists throughout the course of their disease, such as pain, shortness of breath, fatigue. Traditionally, this group of patients are only asked to see palliative care near the end of their life and often in the inpatient setting. But in order to try to maximize their quality of life early in the course of their disease and throughout the course of their disease, we asked the palliative care team to see them close to the time of diagnosis in the ambulatory or outpatient care setting when they were seeing their oncologist and receiving their routine cancer care. So the palliative care clinician would see patients at least monthly, usually after they had seen their oncologist, and usually do a detailed assessment of any symptoms that they were having and try to help them manage these symptoms, and also assess how both the patients and their families were coping with the illness, if they had any distress surrounding their illness, and try to provide support and coordination of care surrounding managing their cancer diagnosis. So all of the patients in this study received their state-of-the-art cancer care here at Mass General Hospital, and we enrolled 151 patients, and they were randomized to either their standard oncology care or palliative care in addition to their standard oncology care. We found some really exciting results. Patients receiving early palliative care had marked improvements in their quality of life. They had 50% lower rates of depression, and they lived approximately 2.5 months longer than patients who were receiving only standard oncology care. The survival benefit of approximately 2.5 months that we saw in this study is actually of the same magnitude of the benefits of chemotherapy compared to no chemotherapy at all, and even similar to the benefits of drugs like bevacizumab when added to chemotherapy for patients with metastatic non-small cell lung cancer. I think that's a really important point. I think one thing that's important to realize about this study is that all of the patients on the study, regardless of which arm of the study they were assigned to, received state-of-the-art cancer care. So all of the patients were treated identically with respect to receiving intensive chemotherapy, receiving radiation. Where we saw differences in intensity of treatment was only at the very end of life. Specifically, we showed that patients who were receiving early palliative care received less chemotherapy in the last 2 weeks of life, which is generally regarded as futile when patients receive chemotherapy in the last 2 weeks of life. But prior to the end of life, patients received identical cancer care, so I think that makes the survival difference we saw even more exciting. I think another important point of this study is demonstrating that expert cancer care and comprehensive palliative care are not mutually exclusive. Not only is a focus on oncology and palliative care at the same time feasible, but it's also clearly beneficial for patients.